We'll start in a minute.
Don't worry about the title on this slide. I changed
It's
it
all
to the one
right.
I gave you.
It's
Yeah, I gave it to
wait,
the one.
the title is fine. We'll start in a minute. So good evening, everyone, and welcome to Medical Mondays with Dr. O, where we believe that strong health gives strong future. We're excited tonight to have one of our Medical Mondays with Dr. O family, Dr. Oluyemisi Famuyiwa, our renowned fertility specialist, fertility doctor in Maryland, who has helped so many people to achieve that goal of childbearing. We're privileged that she's one of ours, and she's back here tonight to share some more insights. And she wrote a book. Guess what? We've been talking about that book before we started tonight. There's a section there that actually focused on healthy living. If you remember Dr. Famuyiwa very well, the first thing that struck me tonight is she has lost weight nicely. And that was the first thing I said, if it was intentional or not. She told me it was intentional, and I was excited. I wanted to know how, why, and she referred me to her book. So without much ado, I will yield the floor to her, but cannot wait to get the book so I can see what she's talking about. Dr. Famuyiwa, the floor is yours.
Thank you
Welcome.
so much. Happy to be back. And this is such a wonderful forum. The audience is so warm and welcoming. And Dr. O has created something really that's just phenomenal. I know what it takes to put something like this together. It's not. So thank you so much for having me. So tonight, I wanted to talk a little bit about what most people think as polycystic ovary syndrome.
No, it's English.
Right. And what prompted this is I don't know if anyone has followed the literature recently. That name has radically changed. And with it came a lot of questions about why and what was the old, because PCO affects about 170 million people worldwide. And there's a delay in diagnosis for up to 70% of those people. So I thought we'll do a little deep dive tonight. So excuse my slides if it sounds too sciencey, as some people say. We will have a chance to discuss um, what it's about later. Now, thank goodness. So it used to be called polycystic ovary syndrome, PCOS, and now it is now labeled polyendocrine metabolic ovarian syndrome. I know it's a mouthful, and I've long said, and if you guys follow I write a blog on Substack as well as LinkedIn. And one of the things I always mention is the ovaries are an innocent bystanders. They have been accidentally dragged into this thing called PCOS. The ovaries are innocent. And I'm going to prove tonight to you that the ovaries are innocent in this whole thing. So, first off, what do they talk about by poly? And see, I'm still having to sound it out one by one myself. Polyendocrine metabolic ovarian syndrome. Why do they say that? Because we realize the ovaries are, like I said, innocent, but it really revolves around your brain, your liver, and your pancreas. And the way the liver and the pancreas are involved is because they are intimately in control of this thing called insulin, right? And insulin is one of the, PCO patients are 10% or 20% are at risk of developing full-blown diabetes. And as a matter of fact, diabetics early on and PCO patients present almost similarly in terms of their ovulatory pattern. Well, we now know a little bit more why, right? So when you change the name, it forces the medical establishment to look beyond the ovary, right? Before, I would get someone tell me, oh, we had an ultrasound and the radiologist told me I had polycystic ovary syndrome. I'm like, how is that? They saw it on my ovaries. Well, that's not the diagnosis. That's a finding, not the diagnosis. It's a constellation of issues. Now, in order to even begin to tell you how the ovaries are innocent, you have to have a basic understanding of how the brain actually regulates the ovary. And it does this by a series of hormones and enzymes. The master conductor of this whole orchestra, this symphony that we call the HPO axis, the orchestral conductor is located high in your brain in an area called the hypothalamus. Let me see if I have if I can find a laser pen. Yeah. Can you guys see my laser? So the hypothalamus is this blue area that's sitting right above this red dot over here, which is actually your pituitary gland. This is where the control is, the control switch. There are other intermediaries, and I'll show you how. But we all know that your eggs, you have a fixed number of eggs. And for the most part, they are lying dormant right after birth. And they start being woken up when you start ovulating, when you go to menarche at age 10, 11, 12, 13, however old you are when you start having your menstrual cycles, until you go into menopause. And what happens is the brain secretes this hormone called FSH, which recruits the tiny eggs down here. Well, that's very simplifying it. Those eggs really start to wake up about a year before the brain calls them to action. And that's it. That's another lecture for a different day, but we won't go down that rabbit hole. So they have to get to a certain size before they start to respond to the signal from the brain called follicle stimulating hormone. This makes the follicles to grow in a systematic fashion. As they grow, they produce the female hormone estradiol, which all that has to do is get into your bloodstream and get sent to the brain so the brain can calibrate just by testing the waters, your blood, how much estrogen you have. Therefore, it will extrapolate how big this follicle is. And when it says, oh, okay, the follicle is big enough, therefore, it must be ready to ovulate. And it will send out a second signal called LH. This is what you measure when you measure your ovulation kit. And it is this signal that causes the egg to pop out. And once the egg leaves, this follicle closes up and becomes this yellowish thing called a corpus luteum, which is always going to die off in about 2 weeks. And then the cycle goes on again, right? Now, the corpus luteum, its job is to make progesterone. So the brain at all times is getting, that's the brain has this like, video alarm camera, it's got its eyes on you, the ovary. So it can tell what's going on and it can send feedback signal, enough of this, try that, so on and so forth. Well, let's look at what happens when we throw a monkey wrench into this system. All right, let's go to, So I told you about how the eggs have to be woken up to the primordial state first. And waking them up takes approximately about 150 days, the whole thing, roughly almost a year, really. And it's not till they get to this antral phase, right? This pre-antral to antral phase that they can start to respond to the brain. And I show you this by blowing it up. So I can now start showing you what an abnormal response looks like. Now imagine that, okay, I already talked to you about how the brain, the hypothalamus, the pituitary, they send FSH and LH to control this. And we know that as the FSH goes to the cells, it makes it produce more estrogen. Now, the reason I show you this, remember this LH, luteinizing hormone, that causes ovulation? The reason I show you this pathway is this LH is also responsible for producing the male hormones or androgens from your ovaries. By the way, you also make it in your adrenal, you make androgens in your adrenal organ. But for tonight, we're going to focus on the ovary. So LH drives production of androgens. FSH drives production of estrogen. That's what's normal. Now, what we're going to do is we're going to throw a monkey wrench into this system. Imagine, so this is the factory that we talked about. You get the small follicles being selected, woken out of dormancy, they get on the factory conveyor belt, and then they go all the way under the control of FSH. And when they're ready, LH comes in, once a month, say, it's time to come out, time to come out. And then plump, you ovulate one egg, right? This is what should happen. Now imagine this factory conveyor belt being jammed up, right? So we got a conveyor belt, we got the small follicles going, get to the antral phase, get to the Graafian phase, they get ovulated, you release an egg. Now, again, this is a talk for another time about fertility preservation. But one thing that's unique to this system is at any point in time, the eggs can also go through programmed cell death, right? They can die at any stage while they're still growing, while they're dormant. As they're growing, cell death is common. And that's why you lose all those eggs that you were born with. You're born with about 6 million, but by the time you get to menopause, you're down to 1,000. Although, if you look at ovulation throughout a woman's lifetime, you can really only ovulate about 500 eggs. So if you can only ovulate 500 eggs, what happened to all the millions? Well, they die off. So this is the conveyor belt system, right? Remember this diagram. Now imagine I take something and I apply brakes. And one of the things I can do to gum up the system is to give you a lot of insulin. And what insulin is going to do is going to halt this system. And if I give you too much LH, because LH that's coming from the brain has to be released in a very specific fashion. But if I flood your system with a lot of LH, I'm going to gum up the conveyor belt. Now, when I gum up the conveyor belt, I'm just going to go back a second. You see these antral follicles here, or the preantral ones, the small ones over here. They also make a hormone called, these preantral follicles, they make a hormone called anti-Mullerian hormone. That is the so-called AMH that everybody measures when they think about testing fertility. Although that's a little misnomer at the beginning, that's another talk for another day. So now, if I have a lot of these preantral follicles, I'm going to make a lot of AMH, right? Anti-Mullerian hormone, because of sheer numbers, right? That's just the way it is. So if I have a high AMH, it tells me, oh, I must have a lot of the preantral follicles. If I don't have a lot, if I have a very low AMH or it's undetectable, then I can safely say that either something is suppressing it or you don't have a lot of the preantral follicles, and we say that you have a low ovarian reserve. You see that argument there? So your AMH originally people thought would measure fertility. It does not. It only tells me what is your reserve like. So bear that in mind, because now we're going to trick this whole system. If I gum up this system, I start to pile up all those preantral follicles. They start to pile up. And guess what happens when you pile up the preantral follicles? I told you they're the ones that make AMH. So then your AMH goes up as a result of the conveyor belt being jammed. Now, there's a problem when you have too much AMH. It's like, which came first, the chicken or the egg? When you have too much AMH, it can go to the brain. We call it a forward feeding brake, and it can cause havoc at the level of the brain. So now at the level of the brain. So now we got three things that are working against you. How does the AMH that is made by the ovarian follicles, how does that make cause you problem at the level of the brain? Let me tell you. So again, just to tell you where the break is. Before you're somewhere around the antral follicle is where the break is broken. So what happens is when you take those follicles and you break the whole conveyor belt, these follicles um, start to block. They get blocked, right? They're blocked. The conveyor belt is blocked. So what happens is those small follicles, when you have a lot of these follicles, they can, one of the things that you see with this is because you have a lot of small follicles, some of those follicles produce the androgen levels, the androgen that you see in some women. If you have a lot of these preantral follicles, they produce a lot of the male hormones. That's one. In addition to that, in addition to making more of the male hormones that are the androgens, the brain puts out more LH, right? That signal that causes the follicle to ovulate. When you have too much LH, you can feedback produce more androgens, if you will, right? Those are the, androgens, the male hormones, if you will. If you have too much of this, it blocks the ovulation. It blocks the eggs from actually ovulating. Okay? So what could possibly be wrong? What happens in PCO patients and also in some diabetic patients, they have elevated insulin levels. How is that a problem? We know we always talk about in PCO patients and in diabetic patients that they have what we call insulin resistance, meaning that your body is not responding to the insulin being produced. What happens is in PCO patients, the what happens is the insulin in PCO patients is not resistant in every tissue. In your muscle, you have insulin resistance in the muscle. However, if you look at the level of the ovary is very sensitive to insulin. So it is permissive to insulin. So what happens is when you have too much insulin, that maybe you have insulin resistance, what happens is the insulin is blocked from working at the level of the muscle, but it's permissive, it's still responsive at the level of the ovary. So when you block it at the level of the muscle, all that insulin has nowhere to go. Instead, it force feeds into the ovary. When you give the ovary too much androgens, too much insulin, it actually, and we won't talk about the mechanism, it leads to androgen production. So how can you get the male hormone, the androgens, being produced in excess? Number one, you give a lot of LH. That's number one. Number two, you give a lot of insulin. The net effect is that you produce a lot of androgens. And then it's like which came first, the kitchen of, the chicken or the egg, right? So what happens is if you have insulin resistance at the level of the muscle, all that insulin is going to go to the ovary and it's going to lead to a lot of male hormones. We call it the androgens is what happens. Okay. So if you have insulin resistance at the level of the muscle, think of insulin as a key. If you have insulin resistance, if at the level of the muscle, let's put it this way, if you block the insulin from working in the muscle, like you just slam the door shut, all that insulin is going to go to the ovary. When you put too much insulin in the ovary, it cranks out androgens. Now, one of the things that can make your life miserable is if you have AMH, because the follicles are blocked, if you have too much AMH, right? AMH can go to the brain. And this is so crazy, but when you have too much AMH, it triggers the brain to start to beat in a highly synchronous manner. Let me show you. So if you think of the brain as a metronome, right? The brain has a clock that ticks tock, like it's tick tock, tick tock. That's how the brain at the level of the hypothalamus stimulates the pituitary gland, which makes FSH and LH. When you have a regular rhythm, a regular tick tock, you're making more FSH. Now, if you wind this metronome and you go tick tock, tick tock, tick tock, tick tock, tick tock, the pituitary gland will put out more LH instead of FSH. So you now see we have a double whammy. We have too much insulin causing androgens. Now the brain is now being fired abnormally and it's making more androgen. So that's what happens here. So the normal state, we're not going to go into the ramifications of this. When you have a normal rhythm, you produce just regular FSH. But if you crank up this system, if you just go tick tock, tick tock, tick tock, you're going to make a lot of LH. And when you make a lot of LH, you're going to make more androgen. So that's the abnormal. So what happens is the reason they changed the name is because it involves the brain, involves the ovary, involves insulin that's being produced from your pancreas. Then you also have glucose being regulated by your liver. So that's where the name Polyendocrine Metabolic Ovarian Syndrome comes about. Poly meaning your endocrine organs, such as your insulin and your pancreas. Multi-organ, it involves the brain, involves the ovary, involves the liver, involves the pancreas because of the change in your glucose homeostasis. All this coming together as a rhythm, if you will, is what led them to say that the name should be changed. It's not just involving just the ovary. So it used to be that we now know that when you have abnormal FSH because of this phenomenon of blocking the eggs, they're now saying in certain patients, you can actually now use AMH level, not just as a marker of ovarian reserve, but it actually can be diagnostic of this syndrome that we're now going to call PMOS or polyendocrine metabolic ovarian syndrome, right? No longer PCOS. And this AMH level is nuanced based on the age of the person. For instance, if you see a 40-year-old person who has an AMH of 8, don't think to yourself that, oh, they must be super fertile. Think this person must have some PCO, right? Now, if you have I've seen people with AMHs as high as 20, and at no level is that considered normal. That's a PCO patient. My PCO patients come in with screaming AMH levels, right? And the older they get, they're telling you you may have to fine tune it. So they gave us this sort of threshold to use. The only reason they don't come up with a hard number is anytime I measure a blood test, the lab that gives me what normal is using population standards to determine what the normal is. So a normal standard, say in America, may be different from maybe in a German population, may be different from a Nigerian population. But needless to say, the point of the matter is, if your AMH is out of whack, it could be diagnostic. And what they're saying is, the word polycystic, we used to throw people off because what they're seeing is those follicles that are blocked on the conveyor belt. It doesn't mean that those are abnormal pathologic cysts. The word cyst simply means fluid field, right? That's all that means. It doesn't tell you what kind of cyst. So when we talk about the ovary, we're talking about a follicular cyst. It's a follicle. So that's a normal physiologic cyst, right? So when you give the name polycystic, it throws people off and they think, oh my gosh, I have something abnormal going on. So that's why they de-emphasized that name. So we can now see that there are other organs involved. And not just your gynecologist may want to be interested, your internist, your family practitioner, even pediatricians, if you have abnormal levels, should start raising the flag that maybe you have the syndrome. Now, we're going to talk very briefly about how can you control this. And there are so many things you can do. One of the things you can do is prevention in terms of, lifestyle. If you're able to build your muscle mass and lower your fat cells, your visceral fat, you can improve your insulin sensitivity. So you can unlock that blockage at the level of the muscle. So the muscle is supposed to be a glucose sink. When there's too much glucose in your system, your muscle is supposed to mop it up, take it out of your system. It is when you have so much glucose in your system, then the pancreas says, wait a minute, this is not normal. And then your pancreas puts out more insulin, trying to correct the glucose level. Unfortunately, the muscle cannot respond to that insulin because the muscle is resistant. So all that insulin from the pancreas is going to go to the ovary and is going to produce more androgens. So controlling your weight, lifestyle modification, resistance training, reducing adipose tissue, reducing binge eating, is one of the ways that you can control it. Other things that people can take is metformin, because metformin, remember I showed you that there's insulin resistance, right? So think of the insulin receptor like a door, and somebody has gummed up this door, it's jammed shut. That's why it's no longer responding. So what metformin is, it blows a bypass doorway, through the back so that it forces your body to start responding to insulin. You can also take ovasitol, which essential ingredient is myo-inositol. It helps the ovary start to respond better to your FSH signal and to lower androgen levels. So those are some of the things that you can take. Other things include making the liver more, sweeping up all the extra glucose so that you can sweep up, drop the level of insulin levels, if you will. Ovasitol is like inositol. It's a supplement that you can use to help improve your insulin sensitivity. It's called ovasitol. It's one of the supplements you can take. Other things that you can use. Remember I told you that the AMH level is abnormally high? Now they are making antibodies to the AMH. When you have antibodies to AMH, you interrupt that abnormal signal to the brain, making the brain rev up and produce too much AMH that feeds back into a lot more LH. So they now have antibodies to abort that cycle. Another things we're now finding is your GLP-1 receptor agonist, Ozempic and all that, it actually can have an effect at the level of the brain to reduce that hyperactivity. And that is something that we're now finding it's a new pathway that we're discovering. So GLP-1 can actually help control the abnormal insulin feedback and LH feedback at the level of the brain. They also have antagonists. It's called fezolinetant or whatever the name is. This is a medication that's actually approved for menopausal patients. And we find that when patients are given this signal, you remember that TikTok thing that I told you is hyper-driven? This antagonist can actually interrupt that pathway. All right, so GLP pathways, weight loss, these are just things that you can do to help correct. These are things that you can help with um, um, from brain regulation, AMH, and ovary. So these are all the pathways that can help. So I just put in there for you that these are all the topics that I talk about in my book, and you're welcome to read it. But these are so many things that I delve in and expose in my book, and you can pick your copy up on Amazon, and we can have a book club discussion at it at some other time. Questions?
Nice. Wow. Thank you so much for being intentional and taking your time to, really explain to us, because what you just presented, most people may not appreciate it, is actually very, it's not easy to say them in English, because these are one of the areas in medicine that it is just the medical lingo or what else, but you were intentional in helping us to break this down. But one of the take homes I had there is actually weight, attributing it to insulin resistance
Yeah,
to prevent fertility problems. Am I right? To just
absolutely.
to
Yes.
sum it
And
up in
that's
one sentence.
Yeah, because excess insulin can jam that conveyor belt and you
Mhm.
stop ovulating. As a matter of fact, this is a bye-bye. Many years ago when metformin was first discovered, you know how they started using it for PCO patients? Some of the original articles, some of you may be science nerds like I am, you can go dig the literature up, came out in the late 70s, early 80s. And it was done in South Africa where they were using metformin as an insulin sensitizer in diabetic patients. So they noticed that these patients started having regular periods and some of them started getting pregnant. So then somebody now said, well, if this can work in diabetics who have some symptoms that overlap with, say, PCO patients, why don't we try it out in PCO patients? And that's how it was discovered. And then, of course, we now have thousands of studies that have studied it. So, and this is part of the common pathway why that works. So, we know PCO, well, PMOS now is intimately tied to insulin control. And PCO patients is a lifelong thing. They are at risk for diabetes in future. And this is one of the pathways that we're now discovering that ties this all together. As a matter of fact, I make a joke that the real name should not be PMOS. The real name should be Polyendocrine Metabolic Multi-Organ Syndrome. Please, let's leave the ovary alone. It's innocent.
You're right, because it's multi-organ. Who would
It's
have thought
multi-organ.
that AMH will come all the way from the brain and then lodge into the ovaries? And we've
No,
seen a
it's
lot of
it's going from the
from
ovary.
the ovaries to the brain,
Yes.
or things coming from the brain to the ovaries, or ovaries
Yeah.
to the brain, either or. But
Yeah.
AMH now going from the ovaries to the brain, who would have thought that?
Yeah.
But it is what it is, and we've seen a lot of infertilities, and people are questioning, why is this happening? This is one of the biggest reasons. So, Attorney Tinu, kindly unmute. I see your hand raised to ask your question, and welcome.
Good. Hello, everyone. Sorry, I have
Welcome.
a musical background because I'm in the nail shop, but I can't miss this episode. Dr. Famuyiwa, we'd already spoken about you 2 days or 3 days ago. So I was really looking forward to this. Thank you, Auntie.
Nice.
This was very highly informative. So, but I was following everything you were saying, but I wanted to know what you just explained to us. Is it the same thing as ovarian cyst? Because I heard you refer to that.
That's exactly what I'm saying. Cyst simply means fluid field. Okay? There can be different kinds of cysts. Follicular cyst, which houses your egg, is one type of cyst. Right? So it depends on what cyst you, in fact, when that egg comes out and you make the corpus luteum, that's a corpus luteum cyst. That's the type of cyst, right? So is it a simple cyst? Is it an abnormal cyst? Is it a chocolate cyst? Cyst simply means fluid filled. You are muted.
So you are muted.
Thank you. Yes,
Yeah.
thank you so much.
Yeah, so this is not cysts.
Yeah.
People with cysts, they would have that excruciating pain sometimes when it gets inflamed. And, they end up in the emergency room and need pain medication and stuff like that. So this is different. But that's an excellent question. Yeah. Sister Ellen Tappin, kindly unmute. Welcome.
Hi, Dr. O. Thank you. Thank you. Good evening, everyone. Dr.
Good
O,
evening.
thank you for a very informative presentation. I'm not going to ask everybody on the call here to raise your hand and to answer. And I am not a medical doctor. Dr. O will tell you I'm an educator.
Yes.
But truth be told, some of what you explained here today, like, look, if 1, then 2, then 2, then 3, and if this, then that, right? I'm an educator. But I had no knowledge. Even though you broke it down very simple, I would like to say it layman terms, I learned a lot tonight from you. So my question is, how can we take this information? Remember, I'm an educator, and information is power, right? So how can we take this information, even break it down simpler, so that women can understand? Because we know in some of our communities, when women can't give birth, there are other kinds of problems based on our culture. But if we can get this information down to our local clinics, to our high schools, and our bio classes, to make people, to educate them so that they could understand, right? We will be better for it. So my question to all of us, not only to you, Dr. Olu, who took the time to break it down, put this on a belt. If this blockage happens, that happens. We know in our car not working, it's not turning over. This is what we look for. How can we get this information into the hands of our people to empower them? That's my question.
My book is
Excellent
available.
question.
But everybody's not going to buy the book. I'm going to buy the book. I heard you talk about a book club, right?
Yeah,
Great,
it's on Amazon.
right?
The Quest for Fertility.
Yeah, but how can we get it down to the fertility clinics, etc., etc., etc.? Thank
It's
you
a
for
good,
allowing me to ask the question, Dr. O.
yeah.
Thank you so much. I'm not surprised at your question because you are not only an educator, you are a lover of people, and not only that, you are always intentional in making sure that our people get their needs met. Even when you share deep personal things. So I'm not surprised. Thank you. Thank you for asking that question. It's a very important one. So Dr. Famuyiwa,
What
give it
I
a stab.
did,
And just a minute,
yeah.
everybody on the platform, she said it, you heard it. The question is not just for Dr. Famuyiwa, it's for everybody. If you have suggestions, unmute. Let's go. Or raise your hand. So in our usual pattern, so I can call on you. Go ahead. Dr. Famuyiwa, go ahead.
Oh, so what I was going to say is the way I wrote this book, it houses the questions or the answers that I wish all my patients know before they go for any treatment. What I put in there is the information that I would like my patients to have. This book is my gift to you, to where I love to take simple things to break it down in a way that helps you understand it. It's my gift to anyone who has sperm or egg. So I wrote it in such a way that you can understand the simple parts of it. It's what I wish all my patients understand before they start any fertility treatment.
So when you showed the book,
Right.
Sister Ellen said, I know that I see the book, I'm going to buy it, she said. But what other ways can we get this out to fertility clinics, fertility doctors? Because I was listening to her. What other ways can we do that? Maybe
Yeah.
have even a doctor's forum?
Yeah, absolutely. Absolutely. I'd love to sit down with people. I try to, I'm always trying to inform most people. I actually teach a lot of PA students and nurse practitioner students and GYN residents. And I give them this book and I make them read it. The unique thing about this book, it's not written in high-tech science. What I do is I take real patient stories, patients who are suffering through PCOS, patients who are suffering through anovulation, their real life story. And I show you how they overcome these things, what led to their success. Because I believe that when you use a real patient story and people can hear and see themselves in that story, there's a level of understanding and a depth of understanding that surpasses just them reading, just plain reading. So it's actually written for, I teach a lot of students, a lot of PA students, a lot of medical students, a lot of nurse practitioner students rotate through. And I'm actually I used to teach GYN residents, they're coming back. And this is the same information that I'm giving them to help spread. Unfortunately, it's only me. I'm trying to get that word out there to educate as many people as I can. I do teach residents at Holy Cross as well, and I present ground rounds all the time too. And hopefully, God willing, I'm going to be presenting at my alma mater, my medical school, again, to share this knowledge with the intention as the more people know this, even on an academic level, they will be the ones to share it out. And when Dr. O reads it, she will come and bear witness that this is not written like PhD work at all. Yet, no matter what level you're in, you can understand it. So I don't believe in using big words to um, confuse people. The only time I might make it a bit more scientific is if I were giving medical ground rounds, right? Then, the audience is different. But even then, sometimes they want me to break it down. So that's my whole goal. My mission is to disseminate information because the more people know, the more I'm going to have patients who don't wait too late.
Mm.
And they will know exactly what is wrong with them. They can say, wait a minute. Oh, wait, that makes sense. Oh, let me ask my doctor to do this test. Oh, that makes sense. It's to stimulate conversation that they can take to their doctor and start. I can't tell you how many patients I see in my office where I go, oh my gosh, we missed an opportunity here. I wish I'd seen this person 10 years ago, yeah.
Mm. I just had somebody I spoke to, and I felt the same way. It was very painful that I wish, we had met like 10 years ago. I actually talked about you in that conversation, that what you would have suggested, what you have, enlightened us to do. I shared it, but it was, I don't know, 5, 10 years too late.
Yeah.
So,
But if we start getting this conversation out, if we start getting, honestly, my book is written where I'm actually, my hope is I can actually get medical schools to actually buy it for students. I've already sent to GYN programs, and I'm trying to get them to buy it for the GYN residents. But ultimately, I want them to buy it. I know medical students have a lot to read, but it could be a summer read. That's where I want to get it. I want to get it into libraries.
yeah. Sister Ellen, kindly almost, yeah, go
Yeah,
ahead.
I don't want to dominate the floor, but
No, you're good.
if
You're
my
good.
colleagues are not asking questions, I'm gonna ask for you,
You're
hopefully.
good.
I'm gonna call you Dr. Olu or Dr. Pham. I'm not sure you prefer to be called. In the space today, we're seeing on patient portals when you go into your doctor's office,
Yeah.
they're using the opportunity to educate you.
Correct.
I'm impressed with your information, but I still don't believe that your information, if we focus on those who are in the medical profession, etc., that it will adequately reach the people who need to know. And I don't have the answer, but maybe Dr. O, as well as you, Dr. Pham, has that information.
So
How can we maybe get your information on a patient portal, so that more people understand there is, if I gathered enough information from you, there seems to be a direct correlation, if you will, to women who might have a low ovulation and might not know they're diabetic, but are diabetic and don't understand why they're not quote unquote fertile or able to become pregnant. And they might be spending money at fertility clinics or even going the IVF route and still lost in terms of why can I become pregnant? So I think that if we can, as a collective, get that information down to our communities, the medical profession is doing one thing. They're doing what they need to do. You're doing what you need to do to educate the medical professions and professionals and says, okay, this is what we need to be focusing on here. But for me, not knowing, how can we get the information in the people who, in the hands of the persons who need to know that if I see these symptoms or if I'm experiencing XYZ, before I do ABC, let me, you know what I mean? Let me explore these other opportunities because there might be something here that I don't know. If I'm making sense to those of you who are in the medical profession.
You are. And, unfortunately, my voice is getting louder. It's not as loud as it could be because I'm not an influencer, but I just put in there my YouTube channel. I give out educational material all the time. And I actually started a newsletter on LinkedIn. I have over 1,000 subscribers. Anyone can subscribe. My newsletter comes out every week. You can go through all the old newsletters where I actually go into detail. I'm actually doing a 4-part series on PCOS right now. Part 1's already out. So you can join my YouTube channel, you can subscribe, and more, you can get the book on Amazon. I'll show you the link. But yeah, so maybe you can be my my voice in the wild, I'm gonna rely on people like you to spread the message, because unfortunately, since I'm not an influencer, all these influencers have more um, clout because they can make a viral, video. But this is the link to the book in here. I welcome everybody to pick up a copy, read it. Just hit that link. I don't know how to make it small. But and if you want, you can come to a forum like Dr. O's, and we can have a book club. And I actually, what we can do, Dr. O. I mean, before, I try not to overextend myself, but read the book, and then we can pick maybe one topic and do like a book club on it. And I can expand on it. I can talk to you about it. But you'll see when you go in there, most of my chapters in the book, they all start with patient stories. And I did that deliberately for a reason, because when people can relate, they can understand. When they cannot relate, it to them it's like, oh, sciencey, and it's over their head. So pick up the book, read it, come back, let's discuss it, share it, leave a comment on Amazon. Since I'm not an influencer, right? I do what I do out of love, really. So it's not, the message is never going to get out unless you, the audience, say, guys, you need to read this book before it's too late. Give it to every young woman that you know. Buy it and give it as a gift to someone you know. Give it as their graduation gift. Because we know some people nowadays, they will never read a book unless somebody tells them, guys, you really need to read this book. And then when somebody says, oh, wow, I didn't know that book was there. So go out there, pick up the book, share it as well. And then maybe next time, Dr. O can host a book club, and we will only treat one topic at a time, because, it's a lot of stuff in the book. And I'm currently recording an Audible version. And as recording is another journey. I never I could do another post on that. That's something else, right? I can talk when I'm talking to you guys. Like when you're recording, your tongue starts to get tied. You have to breathe at certain points and all that. Um, but yeah, it took me 3 years to write this book, but it's a culmination of everything I've been doing for almost over 20 years. Um, that I would say that book it's been 20 years in the making. It's a lot of work and a lot of research.
This is fantastic. Sister Ellen actually said, that's very good. An audiobook is an excellent one, and she commends you. However, I noted something also, in doctors' clinics, most doctors now, there's a screen that when patients are in the waiting area, that, just shows different things. It talks about food, about not smoking, and what smoking does to you, and stuff like that. That may be a good idea to connect with people who the people who put this out, to incorporate some aspects of this in that, because in the waiting area, when people wait, they're waiting for doctors. Doctors' wait can be long. They can actually learn something, especially OB and primary care doctors.
Yeah.
That's something to think about. And, I will see, I think I may have a contact and see, how that can be feasible to do that, because that will speak directly to the public
Yeah,
also,
and
where they sit in.
right, and I'm not even writing just for the audience in America. I'm telling you, because another thing that touches me is I have a lot of patients from all over the world, right? And this is something that people in Nigeria or in India can pick up, because we're just as afflicted with a lot of these things, that people don't know. I mean, I saw a lady today in her early 20s that another thing I treat in that book is um, endometriosis that had been misdiagnosed. And when I'm looking at it, all I can do is shake my head, right? And now I'm like, if you read this book and you see the early warning signals and you hear your story in there, I honestly believe this book can save lives. And I'm not bragging because I'm the one that wrote it. I'm not. Dr. O knows me. I really wrote it just to help people. It's my gift to the world. You know, it's gonna outlast me and outlive me. And this is a book actually gifted to my daughters. And I gave a copy to my husband as well, right? Because I just believe that that information needs to go out.
Our book writer on the platform on Medical Mondays with Dr. O, Adiola Atekoja, said you should connect on the audiobook. She would assist you with that so that we can get that moving really quickly. And, you know, Anthony Akinshola, you can unmute. Yes.
Okay. Yeah. Thank you, Doctor. And Dr. Famuyiwa, in fact, you've profiled the solutions that Miss Ellen asked, you know. In fact, I was thinking about what you just said, the last conversation you had, the last statement you made about social influencing and, you know, people on social media and all that. And then you said something on LinkedIn and all that. I know I'm your friend on LinkedIn, and I know I read a lot of your stuff on LinkedIn. And also I am actually seeing now that you send me something on in my email, you know. Yeah. So I usually will pay attention to it. But above all, my other suggestion is that for people like me, you know, who has and coordinates nonprofit organizations for women and girls, we can also be able to find a way. Maybe we organize for a seminar or a workshop, and then, you know, invite you to, you know, elaborate this and explain it in plain words and language to women in our community. You know, this June would have been appropriate if we had had this conversation like 2 months ago, because of the fact that for my nonprofit, She Rises International Inc., we usually have our literacy month in June. Yeah. And oh my gosh, but I mean, there's always the next time and all that. And for that, yeah, we can work on that also. Yeah.
Yeah.
But wait a
another
minute.
thing.
We are in June. Why is it too late? Even if it's next week, it's doable. It's knowledge she already has that she
I
will
know.
easily impart. So don't limit who can benefit this June. And another thing,
it's the schedule that I'm looking at, but we can still see it.
Discuss the schedule. If she's free, she would avail herself. And not only that, your nonprofit organization, you can raise funds and actually purchase the book and, you know, gift.
Yes. Actually, Auntie is one of our awardees this October. So we are asking her, we'll be asking her to bring some of her her books, you know, and those will be like maybe special auction or gift to ladies, you know. Yeah, that's doable.
I'm not talking about special auction or gifts.
Yeah,
I was trying to conclude a statement.
Okay, go ahead.
Raise funds, purchase the books, and when you bring her out to talk about a topic, she can only talk about a topic.
Yes.
In the book. So, you know, when she talks about the topic, then you gift the book to every childbearing person in the audience because it's already purchased.
Yes.
And then you can gift it to them. That's a way to do that. It's
okay. All right.
Yeah,
Thank
what we're
you.
looking for is if you have sponsors who want to reach out to the publisher and do bulk buys to give it to people, that can be done. The bulk ordering is from Ingram Sparks. They supply libraries all over the country. So yeah, they can do bulk buys. So I'm not even talking individual. I mean, some of the people that need this, if we have banks or organizations that can do bulk buys, there's a critical point in a movement where you start with grassroots and then you hit an inflection point. And that's where all of a sudden it becomes a widely known book because if you think how many millions of people are in the world, how many millions of people are affected with this? And, Dr. O is trying her bit and I'm doing my bit, but there's so many millions more. And it just takes one organization to say, listen, you guys need to read this. If you're a young woman, you can even say, okay, if you know anyone who's about to get married, give them the book.
Yeah.
I certainly will do that.
Yeah, so that they can read about it before
ahead of time.
That's the whole thing. Before they start having problems is when they should be reading this.
Yes.
Fantastic.
And it's written, it's not dense language, it's widely spaced, it's big font, and every single one, like I gave it to a professor, and he and his wife read it between the two of them within 2 days. They said they couldn't put it down. But
So
it's again, I'm not touting my own horn, but it's really simplistic. And I did do my level best to make sure that I break it down into useful information. It's like learning high school biology in a fun way. It's the kind of, look, let me tell you how easily broken down this. When my kids were in, was it 7th or 8th grade, I was asked to give a talk at their school. And I went over the HPO axis at the level they could understand. And they got it. They got it. So you can bring this using analogies to the level where everybody gets it. And to say, like Dr. O and I were talking about being intentional about what you put in your mouth. The more I research food and supplements for my patients, the more I believe my life is better because I'm doing the same things that I'm telling my patients to do. The same healthy foods that I'm encouraging them to eat is the same thing I'm doing. I'm walking the walk, and so whatever I'm telling my patients is what I'm doing for myself because I've researched it, I believe it, and I've seen the impact. I feel healthy.
fantastic. I said it earlier that, I'm sure Medical Monday's family can see the weight loss that you yourself has experienced. And that is fantastic because you are preaching what you do. My darling sister, Nike Fertility, said, well done, Dr. Fam. This information needs to be spread worldwide. And she has her hand raised, so kindly unmute and give your input. Sister Ellen, you see what you started?
Yeah, hello, good evening, Dr. Oh, thank you so much for facilitating this. And to my sister, Dr. Pham, this is really incredible. Well done, well done. Well, I just have a couple of suggestions because this is quite informative, and I thank the previous speaker who insists that we have to spread this. And this can be done, number one, from my own perspective, I believe we should catch the young ladies, at the young age. Because during our time, we didn't have information. We were not exposed to researches and information like this that could help. A lot of people could have been helped if they had this information,
Right.
and they ended up childless and stuff. So if we can, find a way of starting a kind of like spreading it, number one, you notice the young people are more digital. So we have to kind of like maybe recruit some of these young ones who can blow this information out on the digital space. And number two, spreading it to the grassroots is very, very important. There's so many young folks, you won't believe it, that are into this NGOs, and they are doing very well. They go all across the world. I met a couple, I have a couple of organizations that I can kind of like link you up with, that I believe, they can help spread the word. And, we can only try and reach out as much as possible, so that this would help and reach out the different corners of the world. This is a very, very important information that we shouldn't allow to slip. Thank you very much. And I'll be reaching out, sending my suggestions. Thank you.
Don't worry. I'll share your information as well as the our book writer for the audio at the end of the conversation.
All right. Thank you.
I will do that. Dr. Alu says grant TV and radio interviews to further spread the gospel of fertility. Thanks a lot for your insightful presentation. And our Auntie Fumi Oshifade said, thank you, Dr. Famuyiwa, for extending your world of knowledge to all for love. God bless you and all yours for this. We should all buy at least 2 copies of this book and give to our young adults in the family for their own sakes. Thank you again. Auntie, thank you so much for that suggestion. When we were growing up, I don't think we had infertility issues as much as is today. We don't. Dr. Famuyiwa, you are the fertility specialist, even 20 years ago. Am I right or wrong?
You are 100% correct.
Thank you.
The infertility incidence has gone up.
Exactly.
Yeah.
And the question that we're all asking is why? Why? In your book, you didn't mention this, and I think I might have said something in the beginning, but you mentioned also that there's a section dedicated to what you put in your mouth. And you talked about flavonoids, that plums are high in flavonoids and have the highest flavonoids, like 500. That is also very important. And if it does well to, decrease insulin resistance or, diabetes or weight, the list goes on, then it does a lot of important things in the body also. So I encourage everyone, buy the book to gift to people around you, family members, friends. It's a great gift. This is a book like not many others. In fact, I've not seen presentation in this light done the way you did it tonight. You've been on Medical Mondays, you've been a family, Medical Mondays family from almost the inception, and you've been on several times. I remembered your first few times. We can go back to those videos when you were speaking medical lingos, and I'll be like, no, I was interpreting. I'll be interpreting what you said, that means this, that means that. And I'll tell you later, we have lots of people on the platform who are not medical people. But over the years, I saw how you now articulate in English. And tonight, honestly, has been incredible. Even the animations were right on point, because most of us are visual people, and that was very helpful. This is a very, very important time because of the epidemic of infertility that is plaguing the world. People get married and then trouble. So this is so timely. It's incredible. Thank you. Thank you so much again. Deola, kindly unmute. You have your hand raised. Geez, I don't say that much during these talks, but yeah, go ahead.
Thank you very much. Good evening, Dr. Famuyiwa. I want to appreciate the fact that you've done the heavy lifting. Congratulations to you, ma. You know, one of the truths that I just quickly want to drop is that many of our professionals, especially in the African diaspora, we have this problem. And let me not say problem, it's a challenge. And there is always a way out if we seek for help. So I've had the two challenges that we've mentioned. One, the book is good. A good book can remain on a shelf if we don't have a platform or a way or means of getting the information out. And thank God somebody mentioned that you need more awareness, more visibility about the book. And so where I want to come in is the aspect of marketing the book. If there are people that exist that can give you that platform, that can give you the visibility, then that is the next thing. I know you are a very busy person based on your what you do. So you can definitely have a marketing team that all they are going for is to get you on all platforms, any possible Black diaspora platform. I am also will be willing to host you on my podcast. Also, you know, so the more of those interviews, once people can hear about it, it's going to give you more volume and more access to people getting to know more about that. That is one thing I want to recommend, that let it not end here, ma. If your hands are busy, let's have some of the books sitting down. Let me ask that you sit down and just read part of it and you just record in short forms and we post it out. You know, those are some of the way that I'm thinking. If we add to what we have on ground, it will definitely. So I don't even want to recommend
Please
that.
send me send me
Okay.
an email. You
Okay,
can get my email from Dr. O,
all right.
or DM me on LinkedIn.
I'll share your contacts. You see this
Yeah.
DM me on LinkedIn and all that. You're not ready for business. You're not ready to connect.
Yes.
I have two people now. I wrote it down. Right after this, I'm going to connect you guys. And I'll remind you what each promised. And if they don't fulfill their promises, let me know so that I can help you follow up. And it's not you, so that our populace can get the word, can get it out. Sister Ellen, I'm so glad you're coming back, because see what you started.
I started something good, I guess. I hope.
Yes, you did.
I am not in the childbearing age, believe it or not. If I bend my head well, you'll probably see my gray hair. But anyway, I like the suggestions I've heard. And you guys might have seen me bending my head because Dr. Pham, I've already bought it on Kindle. And I'm skimming through it. I'm not suggesting you guys do the same, but you might want a hard copy, etc. But having skimmed the book, Dr. Pham, my question to you first, and then I have a comment. My question to you is, have you ever thought about doing a workbook to go along with this book?
I did. It's just that it took a lot just to write the book. I think that's going to be the next step because it is a lot. It is a lot. So definitely, God willing, that would be my next step. Actually, one of the books I wanted to write is I wanted to write a book about fertility diets, especially as it relates to different parts of the world. So that's going to be one of these days. It's on my to-do list to write, but definitely writing a workbook for sure.
Okay, thank you very much. And I'm glad you touched on diet because one of the comments I made or one of the notes I made is that one of the things we don't tell our people, and when I say our people, you guys know what I mean. I don't have to read and spell and draw for you. We don't tell our people that there is a direct correlation between diet and some of the medical conditions that we experience or they're diagnosed with. But my comment to all of my, well, I'm saying ladies, and maybe there's some guys, so you guys forgive me, but to all of my colleagues on the platform, I'm hearing, well, we can do this and bring back Dr. Pham, and we can do this and bring Dr. Pham. But each of us here might be affiliated with an organization, a nonprofit, a church, a society, or whatever we are associated, whether it's Nigeria, Ghana, Liberia. I'm from the Caribbean, or I'm from Guyana. Where do you see the void, and how can you use your platform to take the book, bring awareness of the content, even if you can't give everybody a book, but bring awareness to the content, and you yourself in your own community organize a webinar, a Tuesdays with Dr. Adiola. I'm just picking any name. A Thursday with Professor Oluyemisi. And if I said your name wrong, know it's from the head and not the heart. Right? How can you now organize a webinar and bring to our people the information regarding this whole concept of fertility? Because as I said, in some of our cultures, it's a thing that break marriages.
Oh, yes.
Right? And
Oh,
create
yes.
conflict.
Absolutely.
Right? So how can we bring this information to them within our own space? Yes, it would be nice if we could get Dr. Pham, but she's only one person, right? But how can we take the information and be intentional of getting it out to our communities to make lives better?
Yes.
I thank you. I'm not coming back with any more questions or comments, Dr. O. I'm done for tonight.
Yes, you can. If you want to. And thank you so much, because your contribution has been amazing. It's been very helpful. This is very important. Infertility in our community needs to be eradicated, needs to stop. So thank you so much for bringing this whole discussion to where we are now, because it's important to get this out. Thank you.
Yes.
Dr. Famuyiwa.
Yeah,
Yeah,
I so believe this. I really do. That's been my whole life mission, because I cannot tell you how many people have come to my office and they go, I didn't know, no one told me. Or maybe they go to a clinic that they feel does not even resonate with their culture or their background. And it's like they're not connecting. And they come to see me in tears. Like I couldn't even get my word out. They didn't even want to even ask me. And when our people talk about, oh, in our culture, we don't do this, they look at them as if they're, they have 20 heads or, a forked tail or something like that. And, I had a patient. I'm not sure if this is in the book. I have so many patients' stories. Let me tell you, this was years ago, years ago. This girl's husband's niece was the one that brought her because she was tired of the way her family was treating this poor woman. They had married her off when she was 13. She was now 30, and they would spit on her. She's barren. She's this. She's a thing. She's not even fit to be a. And the poor woman just. So I was saying, well, why didn't you just find her a different husband in America? She goes, no, because her own family would bring her back and say, you ungrateful child. We gave you a good husband, a good home. Why didn't you? She couldn't come. She was trapped. When I did the workup, it turned out it was the husband that was the problem. And for years, they had abused this poor woman. You see what I'm saying? So how you cannot go to any old clinic and tell that story. Or another story. This one's probably not in. I'm not sure if it's in the book. I had a patient who, full professor, husband and wife in an African medical school, and they told the wife in no uncertain terms that if she did not give birth within a certain amount of time, she shouldn't come back to the home. They are both educated. Both of them professors. So this has nothing to do with education. And people are suffering. I'm sure the people of us that grew up in Nigeria may have heard all sorts of stories. I'm sure they could lend stories to it too.
You
Women
made
are
an
stuck.
excellent point.
Yeah.
We've had, we've had common, platforms where we've seen that the male is the problem. In our culture, attention is always directed to the female. That is true. And that's why, in the right setting, like you all do in the US, I know you do, you screen both the woman and the man to see who has the problem. Can you imagine from age 13 to 30?
Yeah.
Wow.
Yeah.
Well, Sister Ellen, on the platform are many men, probably more men than women. And this is big bro, Mr. Yomi Lawal, who said, thank you immensely, Dr. Famuyiwa, for this phenomenal presentation. It says we are all highly impacted positively, directly or indirectly. And he added that we will share the words, believe me, and that he has 4 girls. But Mr. Lawal is an amazing father. He's different. He's a father of fathers. His daughters are blessed to have him. So, and I know he would do the needful, even here with this. I just know that. His nieces also, nephews are blessed to have him. Sister Nike Fality said she suggests that each of us at least connect Dr. Famuyiwa with 5 people who lead a community of people like NGOs, medical outreach, etc., etc. And Dr. Famuyiwa says she's available July 11th. Sister Ellen says she loves African movies, and this is always an issue in many of them. It is true. It is true. And, the reason why it's an issue in many of them is because even the writers are crying for help. It's a cry out for help, cry out for assistance. So this issue is deep, and there's no time like now to fix it. Thank you so much, everyone. This has been amazing. One of the reasons I like Medical Mondays with Dr. O, because it's not planned. We allow the Holy Spirit to move it the way he wants to move it. And Dr. Famuyiwa, this book is going out to bless and to just change lives. So in African culture, I can begin to say when a woman does not have children, how they're treated. It's that's subject for another day. So what would you like to leave us with as your parting words?
My parting words is, yes, we have high-tech treatment. Yes, we have medication. But there are certain things that if you are aware of, you can proactively change the direction of your fertility. Not in all cases. In some cases, you're going to need treatment. But in a few cases, you can be proactive and you can make serious change before it's too late.
Thank you. Appreciate that. Sister Abiola Johnson says, thank you for this insightful conversation. And Sister Ellen, thank you so much. The Lord gave that vision. I can't take credit, and I praise God for the impact that Medical Mondays with Dr. O has been making. It's all God. Yeah, and you're right. Knowledge is power. Thank you so much, Dr. Famuyiwa. It's been a fabulous conversation.
I am deeply honored that you would have me here. I mean that from the bottom of my heart.
Always, always. And, we